All right, good morning, everybody. We are here for the Marion County Board of Commissioners board session on Wednesday, December 10th, excuse me, 2025. It's 9 a.m. We're in the Senator Hearing Room at 555 Court Street Northeast in Salem. And if you would please stand and join me for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, we don't have anybody sign up today for public comment. All right, we'll move in Commissioner, I almost said Willis, but Cameron to my left today. Brenda, you're really throwing me off with
Isn't
this.
that amazing? I went to your left today.
You did.
All right. Yeah, Brenda said I needed to take a new seat and try something different today. Yeah, and as close as I could get to a red Christmas tie today too. So
Good job.
that's good. I'd be happy to move the consent calendar, Madam Chair. Okay. Under Board of Commissioners, approve an order appointing Colm Willis as chair, Kevin Cameron as vice chair, and Danielle Bethel as second vice chair of the Marion County Board of Commissioners to serve from January 5th, 2026 to the first Monday of January 2027. He's not here. We could change that.
I'm not. I want to be the second. You two can fight it out.
Okay. Under Business Services, approve an invoice with Cannon Cochran Management Services, Inc. in the amount of $103,956.43 for services rendered for November 1st, 2025 through November 30th, 2025 for the Marion County Self-Insured Workers' Compensation Program. Under Health and Human Services, approve incoming funds grant agreements with the Oregon Criminal Justice Commission for services performed in support of the following specialty court programs retroactive to July 1st, 2025 through November 30th, 2027. The Marion County Adult Drug Court in the amount of $409,325. The Marion County Family Treatment Court in the amount of $202,678. The Marion County Juvenile Treatment Court in the amount of $181,647. The Marion County Mental Health Court in the amount of $277,563. And the Marion County Veterans Treatment Court in the amount of $149,946. Also under Health and Human Services, approve amendment number 1 to the contract for services with Passport to Languages, Inc. to add $55,000 due to higher demand for interpretation and translation services for a new not to exceed contract total of $130,000 through December 31st, 2026. Also under Health and Human Services, approve amendment number 1 to the contract for services with John Mitchell Scholar to add $390,000 for a new not to exceed contract total for $989,040 to continue to provide psychiatric mental health nurse practitioner services to individuals receiving mental health services at Marion County Health and Human Services through December 31st, 2028. Under Public Works, schedule final consideration to adopt an administrative ordinance on December 17, 2025 for zone change case number 25-002, Creative Electric LLC. And under Public Works, number 7, schedule final consideration to adopt an administrative ordinance on December 17, 2025 for the consideration for the conditional use comprehensive plan change case number 24-38/TLM Holdings LLC.
I'll second the motion. Is there any discussion? Hearing none. All those in favor, please say aye.
Aye.
Aye. The motion passes. Thank you. And we'll move on to our first item under action for the Board of Commissioners Board Committee appointments for the Budget Committee to consider approval of an order reappointing Denise Bowles to the Marion County Budget Committee with a term ending June 30th, 2028. Where's Jeff?
He's not here. We could,
Yeah, it's an action item, so have at it. Come on up. Okay. Yeah, thank you. Thanks, Sherry.
Oh, no problem. I'm happy, very, very happy to introduce Denise. I know she doesn't need introduction to you. So I'm Sherry Lindner, Volunteer Services Coordinator for Marion County. And as I said, I'm really happy to introduce Denise. Denise is here for basically reappointment to the Marion County Budget Committee. Denise is one of 3 citizen members that serve alongside our 3 elected county commissioners to review and adopt our budget for Marion County. And with that, I'll let Denise say a few words if she would like.
Well, I didn't really plan on my speech today, but anyway, I'm delighted to be reappointed to serve on this committee. I've really enjoyed, I think I've been on it since 2017. And so now it's been just learning the budget, which is a very complex process, but Jan makes it easy for all of us. But I'm really proud of this process and what we do. Marion County does a really good job in some really tough times. And it's great to be a part of that. So that's all.
Well, thank you for your service, Commissioner
yeah,
Cameron.
thank you. Denise, for many, many years, you're probably one of the reasons I'm sitting here back in 2000, when was it?
You keep saying that, and I'm just not going to take credit anymore.
Sometime I read my
the
mission
blame.
statement, and you came up to me and said, someday you need to run for public office. And I really appreciate your involvement, but Jan has moved our schedule up this year. You know, our budget committee hearing is like March 5th. But there's a whole bunch of meetings on our schedule that we're going to get into a lot of detail with some of our department heads on their budgets, and you're welcome to, those are all public meetings. You're welcome to come in if you want to hear a whole bunch of more detail of what goes into some of the process. So
Sure.
just wanted to
Thank
let
you
know
for that
Yeah.
invite. And I was actually thinking about, I always leave the budget committee going, oh, I want to spend some time looking at this or that. And it just reminded me today to get that on my calendar.
I think one of the things that we asked for last year during the budget committee hearing was to make sure that the committee members had access to the documentation, specifically the the spreadsheet that Matt created with the department heads that does the mandatory, core enhanced. And I think what it does is it allows you, one, to understand what we're required by law to do, what we choose to do, and what we choose to enhance in those things in our community based on community input and need. There's, we have a substantial investment in public safety through the general fund. And I would say last year's process, for the first time, at least since I've been a commissioner, allowed the commissioners specifically to interact with the department heads in a way that got really in the weeds. And they learned some things about their budgets and also about our perspective with the community input piece, and we were able to, I think, really craft the budget for the first time in a way to where when I open the book, I understand exactly what it's saying and why, and feel good about the vote I'm taking or the pressure I'm providing either into the program or to the community to respond. So it's a lot of hours, but if you're available,
All right.
it'd be great to have you all there.
And I appreciate, Jan, that you moved up the deadline because I'm expecting my first grandchild on May 23rd. So,
Congratulations.
and I'm really excited. I've had to sit on this for 2 months, so now I'm.
I did read it on Facebook, so it's out there. It's Facebook official.
It is. My daughter put it out last night, so now I'm just telling everybody.
That's lovely.
Yeah.
I'm so happy for you.
I am happy for me too.
As you should be. Hi, Jeff. Nice to see you. Sorry, I didn't mean to throw you under the bus there a minute ago. I will take a motion, Commissioner
All right.
Cameron.
And Madam Chair, I will move that we approve an order of reappointing Denise Bowles to the Marion County Budget Committee with a term ending June 30th, 2028.
I second the motion. Is there any discussion? Hearing none, all those in favor, please say aye.
Aye.
Aye. The motion passes. Thank you, and
Thank
thanks for
you.
being here today.
Yeah.
All right, now we're going to hear from Marion Matthews to consider an amendment number 4 to the incoming funds intergovernmental agreement with Oregon Health Authority. Hi.
Good morning, Commissioners. Ryan Matthews, Administrator with Marion County Health and Human Services. I am here seeking an approval of Amendment 4 of our agreement with Oregon Health Authority, and this is to fund our local public health services. So the total amendment, it would add $558,570.23 for the remainder of this fiscal year. So this is funding for the initial July 1st, 2025 through June 30th, 2026 period. That $558,000 is actually spread over 3 program elements, so I'll just talk about those briefly. So there is an increase of $345,086 to PEO1, which is state support for public health. So this is state general fund dollars that we receive that helps fund primarily our communicable disease investigation, reporting, surveillance, and support that we provide. Then we also have an add of $173,934.23 for COVID-19 active monitoring. So this is actually remaining funds from back in 2020. We received a very substantial amount of funding initially when, obviously we went through the COVID-19 pandemic. There was a very small amount of money that was remaining last fiscal year. And if you might recall, there was a federal clawback of some of the CARES dollars and COVID-19 dollars that occurred. And so it was removed from our contract last fiscal year. What was not spent at that time, I believe that happened at the end of March. And then there's been some litigation and some pushback about whether that could be clawed back or not, and ultimately it was decided that the state was able to retain that funding, and it has been reawarded in our contract. We don't have any sort of active services related to COVID-19, so we'll look and see if there's any eligible expenses that we can utilize this on for maybe some of our services. But in general, this is more of an accounting practice of adding back money that was removed from our prior contract. It technically is still available through the end of this fiscal year. And then there is PE12, which is our Public Health Emergency Preparedness and Response, and that's adding $39,550. Which basically restores some funding that was initially reduced. There were some FEMA cuts that happened at the federal level, and some of the initial estimates for local emergency preparedness dollars was reduced, and now this sort of restored to sort of our normal $133,000 annual amount that we receive. I forgot to mention on the PEO1, that additional $345,000, that was really the funding for the last 3 quarters of the year. So the way the contract started is we only received $103,000. That was for quarter 1, and then they are awarding quarter 2 through 4 of this fiscal year, which is that additional $345,000. So it really gets us up to a total that we're anticipating. It's not necessarily $345,000 of new dollars. It's just sort of the timing of when those funds were awarded. And I'm happy to answer any questions you might have about this amendment.
So the only question I have, I think, is on the public health emergency preparedness and response. It's not really a question, since this is money that's coming back, and there was not a discussion and or plan created earlier this year. Can you guys come to the commission and discuss a plan in the investment of those resources? One of the things that comes to mind is the necessary space to have the conversation around meth-induced mental illness. And I don't know that you know this, but I've been working with the public health team on outreach and communication, specifically requested by the lead navigators.
Yeah, you've been meeting with them.
Yeah, so they're getting ready to introduce a campaign. In fact, today you'll be seeing some flyers before they're disseminated into the community around methamphetamine awareness and its direct connection to mental illness. There's probably a significant amount of data and evidence that leads to the outcomes that we're seeing in our community, but we've not really done the work and the research to be targeted. And I think it's an emergency at this point, in my opinion. And if there's a bridge to connect this resource that we haven't really invested in, I know it's not a lot of money, but maybe it can help offset some of the costs you're incurring now with this. I want you guys to focus on this project and create a community awareness campaign. I know that there's a lot of areas that it can be invested in, and I don't mean dollar invested, but time invested, education investment around the issue. I think it's time that we really start speaking into the community around meth use and its now direct connection to a lot of this SPMI that we're seeing, and the burden it's facing on our resource system of care.
Mm-hmm. Yeah, and we definitely do have like a prevention team, for example, that's already started to get involved in that campaign.
Yep.
And I think we can leverage resources across kind of multiple programs that kind of touch that space. I think these dollars specifically tend to be for ICS training, the instant
Okay.
command structure training. We do desktops and exercises and things. And so it's a lot of it's to sort of build that emergency response. So if we were to ever face a wildfire, an ice storm,
Okay.
a pandemic, that we have the plans in place, the structure in place, and the infrastructure to kind of respond to that. So
Yeah.
this is a little more narrow, but I
Okay.
think what you're speaking to is kind of more broadly both on our substance use treatment side as well as on our substance use prevention. And I think there's some of these substances that sort of they sort of took a back seat to fentanyl and some other higher priority ones. And I think now we're starting to see that there's anytime you aren't addressing or aren't informing the public about some of these other drugs of choice, they gain popularity, they cycle back, or they have impacts that people really don't foresee, or they haven't been educated on, when they're making some of those choices. So I think that, I think it's an unmet need, something we want to work with you on.
Thank you.
Yeah.
It comes to mind thinking of a recent, Salem Police Department does a pretty good job of announcing when they do large busts. And the sheriff's office occasionally does that too. And this year I've seen a rise in the information sharing around substantial, what's the word where they're bringing it in? Collection of meth. Yeah, confiscation of meth in traffic stops. Last year it was fentanyl pills and bags in large quantities, and for some reason it's shifting. I don't understand the drug market really and why that's happening, but you're right. If we don't talk about it and continue to provide prevention and awareness around it, it seems like it just grows, and I'd like it not to do that.
Yeah, and I know we're looking at gaining some data too that we can kind of go back and maybe we can start to see some of the trends, and we might start to see like an uptick in utilization of meth specifically, and then that just sort of speaks to we need to do more education outreach. We need to have more of a strategy in how we want to deal with that.
Yeah, thank you, Ryan.
Yeah.
All right.
Good, you
Yep,
ready? Okay. Madam Chair, I'll move that we can approve an amendment number 4 to the incoming funds intergovernmental agreement with the Oregon Health Authority to add $558,570.23 for the PE 01-01 State Support for Public Health, PE 01-09 COVID-19 Active Monitoring, ELC, and PE 12-01 Public Health Emergency Preparedness and Response for a new IGA total of $8,069,462.83 retroactive to October 1st, 2025 through June 30th, 2027.
I second the motion. Is there any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Aye. Motion
Thank you,
passes.
Commissioners.
Thanks, Ryan. All right, we don't have any public hearings today, and that's the final item under action. Commissioner Cameron, do you have anything you'd like to add for the record? Want to talk about SRS reauthorization?
Oh, we got yesterday. Well, we celebrate victories like that, but it's still, it's still not where we need to be, but
It's a fill in the gap right now.
It's a small fill of the big gap that's
Yeah.
out there. Especially, we're not impacted by it like a lot of other counties. We appreciate the revenue we get from SRS, but and when people look at that, it says it goes to the counties, but it goes back into the county tax reallocation, and most of it goes back out to schools. We
Right.
get a little bit of it. But you take counties like Douglas County, they're really, really gonna hurt. And there's some counties that are, well, you can read all about it, that are upside down budget-wise. But SRS is a little bit. And it's something that started in 2000. Senator Wyden and at that time Senator Smith worked together on that bill, but when it started in 2000, it continues to decline. But yeah, the House approved it yesterday. It's going to the president's desk. I'm sure he'll sign it really soon. So,
Yeah,
yeah.
one step forward.
Small victory.
Yeah. All right. Anything else? All right, we're adjourned. Have a good day.